Black spot in infects endocarditis. Endocarditis is an inflammation of the lining of the cameras and carots. Cause endocarditis involve the harmless epiphrenic divertcula. Most people would develop epiphrenic divertcula and typical areas proximal to the lower esophageal ducting of the endocarditis of phylogenesis of the esophageal.
This is Dr. Kel Shipley with a review of endocarditis, cardiac valve vegetation, and stroke. Endocarditis can occur when there is fungal or, more commonly, bacterial infection in the bloodstream, a condition known as septicemia or sepsis. As the organisms travel through the heart, they attach themselves to the valve leaflets between the heart chambers. The oxygen and nutrient-rich environment found on the left side of the heart results in rapid growth of organisms, which form clumps known as vegetations.
The layers of the wall of the cavities or from which they are formed.
Unpredictably, the vegetation
Next opportunity presents an older person with difficulty to swallow. Generally, it's solids. You give the patient the majority of difficulties, liquids are not. So they often have that problem. One of the things that happens is that people get stuck in the diverticulum, which is actually a sac. And because of that, the patients will often complain not just of sticking, but fullness in the neck. And then they'll actually cough out the food 20 or 30 minutes later after eating, and the food will be completely undigested because it's sitting in your throat and has gone down the stomach where it would have been digested. So that is something very typical of an endocarditis.
Infective endocarditis is an inflammation of the heart. It can damage the valves of the heart muscle, or the lining of the heart. It's caused by bacteria that enter the bloodstream. Many common dental procedures, such as routine teeth cleaning, can cause minor bleeding that might allow these bacteria to enter your bloodstream. For most patients, these bacteria are harmless. But if you have a medical history that includes a heart birth defect, prolapsed valve, rheumatic fever, endocarditis, heart surgery, or other problems, we need to take special precautions to protect you. By prescribing an appropriate antibiotic that you take before your dental appointment, we can avoid the risks of endocarditis. If you have any drug allergies, or if you have questions or concerns about the procedures, please let us know. We want to protect you and keep your teeth healthy.
There is the abnormal presence of a pouch in the throat which causes food and liquids to get caught during swallow. In a normal swallow study, everything clears easily down the throat, but in a patient with a Zenker's pouch, things get caught, causing symptoms of phlegmy throat, food regurgitation, aspiration, and trouble swallowing. Traditionally, surgical correction required an incision on the neck and pouch size, which resulted in a long recovery. However, recent surgical advancements in the late 1990s resulted in a new endoscopic technique to correct this problem without any incision in the neck. Rather, after intubation, a laser-surgical device is placed in the mouth and pushed down into the throat once the pouch is visualized, along with the common law dividing and small swallowing, the laryngoscope is placed in the subject. Here they indicate how the laryngoscope is placed to pouch. Once the laryngoscope is optimally rigid in the scroll, then observed in order to optimally activate the here, the line is the swallowing clearly illustrating common law separating and all the complications. Sutures are placed to stabilize the common law of preparation for the state of determination. placed in tension. The stapling device is then inserted such that the common wall is placed between the stapler blades. With activation of the stapler device, it simultaneously cuts and staples the cut edges together, resulting in a V-shaped division down the common wall. The sutures and any free staples are then removed. With this common wall division, any food or liquids that enter the pouch region would automatically spill over into the swallowing tube. Nothing will get trapped anymore. In essence, the pouch has become the new back wall of the esophagus. The patient is discharged hours after the procedure and is allowed to start drinking and eating the very next day.
This is a routine gastroscopy in a 78-year-old patient without dysphagia. In the lower third of the esophagus, we have this incidental finding: a large-mouthed epiphrenic diverticula with the esophageal lumen on the right side. The diverticulum is completely empty, without food or fluid. It is known that epiphrenic diverticula are formed as a result of elevated intramucosal pressures due to primary dysmotility disorders. However, at least endoscopically, we do not have a suspicion of a dysmotility order, for example, achalasia. Of course, no treatment needs to be initiated in this asymptomatic patient.
Conclusion. The epiphrenic diverticula are apparent. The cause many asymptomatic pacientes may pneumonitis. Usually, the diverticula occur immediately elderly, with most discrete signalis. Everyone agrees that symptoms patients should be treated separately. The main diagnostic method is the esophagogram.